Welcome to the Healing Pain Podcast with Dr. Joe Tatta. Each week, we interview top experts in physical therapy, pain science, and integrative pain care. You'll learn the most up-to-date information for treating and reversing persistent pain. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here's your host, Dr. Joe Tatta.
Hey there, friend. Welcome to another episode of the Healing Pain Podcast. Today, we are once again discussing nutrition and chronic musculoskeletal pain. And actually, today's episode is an update. The reason why it's an update is because until a couple months ago, if you went into PubMed and looked for a systematic review or a meta-analysis on how diet and nutrition influence or impact chronic musculoskeletal pain, you would have only found one review. I'm excited today to introduce you to a researcher who is also a physiotherapist who has completed the second systematic review. It was available in the March 2020 Journal of Clinical Medicine. It's an open access paper, so we'll link to it in the show notes so you can access it. And the title of that review is Do Nutritional Factors Interact with Chronic Musculoskeletal Pain? A Systematic Review. My expert guest this week is Omar Elma. He has been a physiotherapist since 2014, and he is currently pursuing his PhD with the Pain and Motion Research Group with a focus on the link between chronic musculoskeletal pain and nutrition. On today's episode, we'll discuss the findings of his systematic review that investigated the interaction between nutrition and chronic musculoskeletal pain, the mechanisms of action between nutrition and pain, and how diet and nutrition interacts with central pain processing mechanisms, the role of the gut microbiome and its interaction between nutrition and pain, and finally, how nutritional factors affect the sensitization of the central nervous system. Okay, without further ado, let's begin. Let's meet Omar Elma, and let's look at how nutrition factors influence musculoskeletal pain. Hi, Ömer. Thanks for joining me on the Healing Pain Podcast this week.
Thank you for giving me an opportunity to participate and to have a conversation with you, Joe. Thank you.
Yeah, it's definitely a topic that everyone who follows the Healing Pain Podcast is interested in. And it's a topic that more and more integrative practitioners and more physical therapists are interested in. First, before we start to talk about nutrition, just tell us about your current work, kind of give us like the broad overview of who you are and what you're doing.
So I'm a physiotherapist and I have only a physiotherapy background. So I want to just little bit tell about my how I like a bit about my history of coming to this PhD position. Like after my graduation, I mostly worked in orthopedic rehabilitation field. It was for 2 years. And during these 2 years, although I was not like structurally aware of kind of biopsychosocial approach, I was trying to care about patients' like psychological situations because my sister, she's a psychologist, and we were always having talks about health psychology, and I was reading her books of health-related context. So I noticed that like implementing psychology science in pain management had obvious positive effects on treatment outcomes of like patients. So with this experience, I started my master program at the University of Nottingham, and it was again on advanced neuromusculoskeletal practice. Like there, I had more opportunity to learn and expand my knowledge on like various components of chronic pain, like including social factors and lifestyle factors. And during these times, I met with Pain in Motion International Research Group, and with the help of my talks and discussions with Professor Yones, I realized like how less attention has been given to the nutrition as a lifestyle factor. And then I have decided to study the link between nutrition and chronic musculoskeletal pain. And this is why I'm here. And I started to work here at the Vrije University Brussels in Belgium. And now we have nutrition and pain research group here. And we are doing our research on like mainly two group of patients, chronic musculoskeletal pain patients and breast cancer survivors who has chronic pain, but my field is chronic musculoskeletal pain. So yeah, until now, in our work, like and publications and works, we were aiming to bring together and to give an overview of the available literature, to raise awareness about this topic, and to share our ideas with the scientific community and the clinicians and patients.
Yeah, I think
This is a
it's
big.
definitely excellent. I mean, as physiotherapists in the United States, nutrition is more and more a part of our graduate training and the Doctorate of Physical Therapy programs, both as far as health and wellness and promotion, but more and more nutrition is just kind of becoming like another modality we use, just like therapeutic exercise or pain science education. Nutrition is really being elevated to that level in our profession. So it's great to see a physiotherapist and a researcher like yourself help us make the connections that we're seeing in clinical practice, help us prove what those connections are, so it becomes valid for our practice. You, of course, recently did a systematic review that investigated the interaction between nutrition and chronic musculoskeletal pain.
Yeah.
Can you kind of give us some of the highlights of what you found in that systematic review?
Of course, like this review constitutes my like our first step in the research line, like research line pain and nutrition. In this review, we were mainly aiming to see like how dietary patterns of patients and components of their diet interact and linked with their pain, and therefore we include both like observational and experimental studies. Like one important point here, as a nutritional factor, we investigated overall diets and dietary patterns instead of focusing on single nutrient intakes, because this is also in the literature, like it is suggested as a more natural way of searching nutritional factors. In this way, by investigating overall diet, it was possible to take into account synergistic effects of all nutrients that are consumed together. At the end of review process, we ended up with 12 studies, and 9 of them were experimental and 3 were observational. 7 out of 9 these experimental studies reported improvement in chronic pain. So they were saying like dietary change can affect chronic pain, and these positive pain reducing diets included vegan diets for fibromyalgia and rheumatoid arthritis patients, and weight loss calorie restricted diet for osteoarthritis patients, and vegetarian diet for general musculoskeletal pain, and FODMAP diet for fibromyalgia, peptide diet for rheumatoid arthritis. This type of diets has effects on these patients. Like from the observational studies, the evidence is really weak because it's not easily to have like to research nutrition like observationally and to have like scientifically strong evidence. And but I can mainly like mention rheumatoid arthritis patients maybe can show like insufficient intake of some micro and micronutrients such as like calcium, folate, zinc, magnesium, vitamin B6, and fibromyalgia patients, they show lower intake of carbohydrates, proteins, lipids, vitamin A, E, K, this kind of like micronutrients and micronutrients. And also the last thing maybe I can say about like from the observational studies about the association between pain severity and the intake of some nutrients. And this is like pain severity we found they reported like is positively associated with fat and sugar intake in chronic osteoarthritis patients pain, and the pain threshold is found like positively associated with protein intake. So these were like main findings that I can mention here.
Yeah, and that right there is a lot for us to kind of maybe discuss for a little bit and unpack. So you mentioned that you looked at different types of overall diet changes, basically. So taking someone who was on, let's say, their standard everyday diet, and then changing their dietary pattern toward, as you mentioned, a vegetarian diet or a vegan diet. You mentioned a FODMAP diet in there.
Yeah.
So they looked at different types of diets. One thing that you said, which was important, which we haven't really gone into detail much on this podcast, and I want to kind of bring it to light here a little bit, is that nutrition and pain studies are very difficult to conduct. And they're very difficult to do in a way that really has a lot of power behind them. Can you explain to us why that is, and potentially why we're not seeing as many studies on nutrition and pain?
Yeah, actually, this is something I experienced when I start collecting data and when I start to read actually articles, because nutrition, like human body by itself, is complex, and we are talking about the pain and chronic pain. It is more complex than we know, and nutrition research is really difficult because nutritional factors can have many interactions with many factors, and we don't know the result is exactly because of the nutritional intake or dietary change or something else, because we don't know also the interaction mechanisms, what is happening in the human body. It's not really easy to figure out what is happening there. And also, as I said, like the diet itself, there are like many factors that can affect your results, and you cannot control these results in your laboratory or in your study. So this is, I think, I think from my point of view, one most important thing that we need to like deal when we conduct the research on nutrition.
Yeah, when I look through the literature on nutrition and chronic pain specifically, one of the things that always strikes me is that so often there's the lack of a control group.
Yeah,
and I think if that right there was just taken toward more diligently, I think we'd have some better information, and certain practitioners would feel more confident in using nutrition in their practice. And then you mentioned just the idea of nutritional factors not affecting one, let's say, process in our body, but affecting multiple at the same time. And there could be pros and cons to that, because the pro to it could be that, well, it could influence pain positively, and it could also influence cardiovascular disease positively. So there are two sides of the coin to that as well. Talk to us about the mechanisms behind what you discovered with regard to the interaction between nutrition and pain. So specifically, we're looking at pain processing mechanisms. What did your research discover?
Yeah, this is again like the one thing that I have learned during my readings in nutrition research. It's difficult to identify the exact mechanism of action, and however, if we bring together relevant research and some dominant underlying mechanisms, can maybe help us to explain the association interaction between pain and nutritional factors. So in our systematic review, when we consider the findings and the way that their theories, and among studies that found positive effect, the main point is, like we can collect under a broad term, is healthy eating. So because most of the effective diets were like plant-based diets, and compared to like omnivorous diets, they are like plant-based diets such as vegan and vegetarian diets have higher scores on healthy eating index and this kind of indexes, if we look at how they are healthier, and they are healthier or less healthier than the omnivorous diet. So if we analyze the components of these plant-based diets, studies show that they show more nutritional sufficiency, and the amount of nutritional intake is more in line with recommended daily intakes. So compared to omnivorous diet. And if we go more specifically and if we go more in depth, one of the most important impacts of dietary intakes is their effects on neuroimmune system, like their effects on neuroimmune activation. For example, another index that we can use to see this association is dietary inflammatory index, and this index is used to measure the inflammatory potential of specific foods or dietary patterns. Like from this point of view, we see that plant-based diets are more pro-inflammatory. So they have a relieving effect on systemic inflammation, and which can lead pain relieving as well. Because chronic low-level inflammation is suggested like one of the underlying causes of chronic musculoskeletal pain conditions, like including low back pain, fibromyalgia, and etc. So therefore, their effect on chronic musculoskeletal pain might arise from their pro-inflammatory characteristics. And lastly, I mentioned as I mentioned before, like calorie restricted diets are also suggested as effective on osteoarthritis pain. I know there are like also conflicts on this type of diets. However, it's not clear how this type of diet act on pain, because all the patients showed significant weight loss, and therefore the impact of this type of diet can be explained basically its effect on weight loss. Because on the other hand, here again, like the neuroimmune system can play a major role, and because obesity itself associated with increased serum inflammatory biomarkers, therefore a decrease in adipose tissue, especially in fat mass, can result in decreased systemic inflammatory biomarkers and inflammatory responses. So this will lead again pain relief in this type of patients, like in these patients. So these are like healthy eating, neuroimmune activation, and maybe weight loss by itself, but it depends. It depends the patient's group, because then the mechanism action is changed. This is what I see in the.
Right. So the neuroimmune part really speaks to practitioners who are interested in treating chronic pain, because we know that pain is a function of the nervous system. So that kind of makes kind of the green lights blink on and off. And then you mentioned weight loss. So of course we think about pressure on joints, especially the weight-bearing joints, although you're actually taking it a step further, which I appreciate. And you're saying, well, if there's a decrease in specifically visceral adipose tissue, that leads to a change in inflammatory biomarkers that can be measured in basic blood work.
Yeah.
And then, so if we take that one step further, and the microbiome is on the tip of everyone's tongue when we're talking about nutrition, what did your research tell you about the gut microbiome with regard to certain chronic pain conditions like fibromyalgia or rheumatoid arthritis?
Yeah, here, this was also like kind of like a way, kind of like mechanism of action of diets that can they affect pain, but it was like related with the neuroimmune activation. That's why I didn't mention it like specifically, but it's well evidenced that there is a bidirectional relationship between a central nervous system and good microbiota. So microbiome, which is called like good central nervous system axis, and patients with chronic musculoskeletal pain, for instance fibromyalgia, can have alteration in their gut microbiome, and alteration in the gut microbiome can cause systemic inflammation again, and inflammation in the central nervous system, which can contribute to pain chronification and amplification also. It is known that dietary intake, and we know like dietary intakes can affect gut health. Therefore, in chronic pain patients, gut microbiome can be a therapeutic target as well. So from this point of view, it is reported that compared to omnivorous or Western style diet, plant-based diets such as vegetarian, vegan, and Mediterranean diets, they play an important role in protecting the stability and diversity of gut microbiome. So the reason behind this interaction, when we also see the literature between plant-based diets and the healthy gut microbiome, is the high proportion of some specific nutrients that have positive effects on gut health, such as like high amounts of dietary fiber, polyunsaturated fatty acids, plant-derived proteins, and polyphenols. So yeah, therefore, the application of more plant-based diet might alleviate chronic musculoskeletal pain by their positive effect on gut microbiome and eventually on systemic and central inflammation.
So the microbiome has an immediate impact on the function of your nervous system, because there's a bidirectional relationship between the microbiome and your central nervous system. And
so this is what we can from the readings, what we understand is, yes, there is a bidirectional relation, and you can have negative effects with your poor diet or lifestyle, the other lifestyle factors, or you can have positive effects and have more healthier gut microbiome, and you can have a positive effect on your nervous system. Yeah.
And it's important because we're seeing a lot of changes in the literature with regard to looking at the microbiome with many different types of chronic diseases that are either primary or secondary to people living with chronic pain.
It's like also this is a kind of new approach to the in the pain field. That's why day by day, like with readings, we see like microbiome is kind of like second brain, they say.
Yeah.
I don't know how correct it is, but for us, it's really constitutes an important place to investigate, to find out the more comprehensive approach to the chronic pain and pain.
Yeah, and I appreciate that, because I think as physical therapists, if we go back a couple of decades, we would say, well, our way into the nervous system, our way to influence the nervous system in someone who's living with chronic pain is through exercise or potentially manual therapy. And then over time, as we've noticed the psychosocial factors become more important, then we're looking at things like kind of top-down mechanisms where we have educational interventions, psychoeducation interventions, or psychotherapeutic interventions. And now really what you're saying is the research is pointing strongly to a third way, this second brain, if you will, that through diet changes we can influence and modulate the nervous system.
Yeah, of course. I'm saying this like when you say this, I remind just a kind of like story. Once a scientist attends a congress and he asked about he asked a professor who is really like into the brain field. He asked what is the proportion that you can say how much of the brain that we know, and he say like 5% or like 30%. I don't know. But the next year when he asked the same question, he says we know 1% maybe. But how it decreased, because as much as we learn how we are how we know less in this field. So for me it was the same when I start doing research on pain. I was thinking, okay, I will memorize the physiology and neuroanatomy of the pain, and then I will know some ways like manual therapy and some therapeutic agents, and then it's okay. I will just do it and then finish. But as much as I read, I learn how it is complex and how we need to we are not aware of the things that we don't know. So day by day we will see how it is connected with other factors that even we don't know now. Science is this cumulative. It's just accumulating. So
Omar, as a physiotherapist, how has your investigation into nutrition changed your perspective on how we can help people with pain?
So, as a physiotherapist, I don't know in US or in another countries the how physiotherapists the rights of physiotherapists in the clinical practice. But I'm from Turkey, and there we don't have actually the strong. I think even we cannot touch patients for manual therapy without permission of doctor. So, but patients, they ask for something that is, I don't know, is for all patients, but something like drug or something like to change their life. It's not just show exercises and do some electrotherapy and send them home. So for me, I find a way to touch their life. I think this is something important for me. And with the nutrition, it's not only the pain that you target, it's also the quality of their life. And I think, this is also like two ways intervention. You will manage pain, and then also it will be kind of preventative rehabilitation for the next maybe problems that will occur or that you prevent to occur. So for me, this is a kind of like I find a therapeutic intervention that I can use in the clinic.
Yeah.
Easily and yeah. So.
Nutrition's a really powerful contextual change agent. That's the way I look at it. Like if we want to change the context of someone's life and move them toward a life of cultivating pain versus a life of moving beyond their pain, nutrition is a really powerful way to cultivate and change that context for people, because of course it nourishes your body, but in a lot of ways it nourishes your soul. It affects your social connections. It affects so many aspects of how we live as humans. I'm also wondering, how has your diet changed since you've been studying nutrition? Have you explored more? Have you experimented more? Have you looked back and said, well, I've been eating things I may not should have been eating, and made some positive changes? Has it been helpful for your behavior change?
So we have saying, I think in English also there's saying something like, it's like, do what I say, but don't do what I do. It's yeah, for me, it's kind of like, I'm Turkish and I like to eat food. So now I know how unhealthy I am feeding myself, but before I was not aware of it. So day by day, I'm trying to change also my diet, because yes, now maybe we don't have any pain, but we don't have any problem, but it doesn't mean that we will have in the future. So I'm trying to change, but it's not easy actually. This is a nice experience also. Like we are saying, using nutrition as a therapeutic target in the clinical practice, but we know it's not really easy to change habits of people. So then I think I will also keep this in mind and to find more effective ways. And also I'm trying some, like when I learn a type of diet, I'm trying in my life to see the effects and to see what are the difficulties in this type of diets. Then, for example, if I start to work with the patients, I will keep these all experiences in my mind and then try to give from this line that to make it more applicable, more doable for them. So
That's right.
but for in my life, it's not changing, I think, a lot. I need to be honest here. So.
I always tell people, physical therapists who explore nutrition and ask me questions, I always say, think back to when you were in physical therapy school. You tried every exercise and you tried every joint mobilization on yourself as well as on other people. And it's the same with nutrition. Like when you learn a little bit about it, you have a foundation base of knowledge. Maybe you start making some small changes on your own, try different diets, try certain supplements, see how they work on yourself, and then you gain a little bit more confidence to use it with other people. You mentioned during our chat here a plant-based diet a number of times, and I want to come back to that because the word plant-based means a lot of different things to a lot of different people, and plant-based can encompass many different diets. Is that correct?
Yeah, exactly. Like even we say plant-based is kind of like group of diets. You can put many type of diets in this plant-based diet. But I was just trying to collect them under a broad term to make it easier, more to understand. But also, like, if we go more in specific, like, for example, if we say Mediterranean diet, but also it doesn't mean one kind of diet. Also, when I read research, they say like vegan diet, but there are some changes always. It's not the same vegan diet that they follow in the research. So for me also, after our systematic review, we were really willing to conduct a like kind of meta-analysis, but with the results it was not possible, because the nutrition is not same for all. Even it's a vegan diet, it's not same vegan diet, and there are more heterogeneity in the same term even.
Right.
Yeah,
so a plant-based diet simply means the base of your diet, or the majority of your diet, is plant food. So for instance, a Mediterranean diet, as you mentioned, there are many different types of Mediterranean diets, because there are many different types of Mediterranean cultures. And even in the US, our nutritional associations have tried to adopt the DASH diet, which is similar to a Mediterranean diet, with less of a cultural kind of context to it, but doesn't necessarily mean that it's a meat-free diet necessarily.
Yeah, exactly. So the amount of meat, amount of how you cook it, and the type of meat, so it changes, and this changes the healthy characteristics of your diet. And so of course, as you said, it doesn't mean like meat-free diet.
Yeah, that's right. And I always encourage people, as people are listening to this episode, and this is for researchers as well as clinicians, and as well as for people who are interested in helping soothe their pain with nutrition, so to speak, is that nutrition changes throughout your life. So your nutritional needs may change as you exercise. Your nutritional needs may change as you develop a condition, or as you overcome a condition, and your nutritional needs may change as you age as well. So they're all really good topics to talk about, and they all point back to that plant-based diet. And you can, within that plant-based diet, it's not constrained. There's flexibility there to make changes that are right for you, and a form of personalized medicine really for your body. All right, it's been wonderful chatting with you. Tell us what's next in your line of work with regard to nutrition and research.
So as I said, like, as much as I read, that I learn how we have a long way on the road. So this is just first steps that we revealed some articles and publications to bring together these kind of ideas. And first of all, we want to influence and give inspiration to the researchers to collaborate, and to clinicians to think about implement nutrition in their clinical practice. This is, I think, the main idea of doing research for me. I don't know, maybe someone can say something different, but for me, because this is what we do. And here I want to just share something with you. Like, once I read in a paper, it says like it takes 10 years a scientific knowledge transmit into the practice, or approximately 10 years. I think this is a long time, and we are trying to and thanks to you, and with these episodes, and maybe we will decrease this time to just start to practice in the clinical practice. So, but here what we do is now we are preparing some experimental research that we are interested in. For example, kind of like blood glucose levels, pre-diabetics, diabetics, and the glycemic response and their relation with the pain. So these kind of like ideas we have in mind. Now we are working on it. So I hope soon we will share with the community these findings. Yeah.
Excellent. We definitely appreciate your work, and we appreciate you making these connections for us so we can understand how nutrition has an impact on the central nervous system, on the microbiome, of course, on central processing mechanisms with regard to chronic pain. Omar, it's been a pleasure chatting with you. Let us know how we can learn more information and follow your work.
You can follow the publications from ResearchGate, or I'm a member of, as I said, like International Pain in Motion International Research Group. You can follow from there. These two channels. I think I don't use social media, that's why I cannot share with you this type of channels. But these channels, I think generally we get in contact with the people and we collaborate from these channels. Yeah.
I want to thank Omar for being on the podcast this week discussing nutrition and chronic musculoskeletal pain. You can, of course, learn more about him by searching on ResearchGate under his name, Omar Elma, or you can go to the Pain in Motion group and you can find them at www.paininmotion.be. I'm Dr. Joe Tatta. Please make sure you share this episode with your friends, families, and colleagues who are interested in learning how nutrition can be used to treat musculoskeletal pain. And make sure you sign in and stay connected to us by going to the Integrative Pain Science Institute.com. Go to the podcast tab and you can sign up for the latest episode, which will send you to your inbox each and every week. I'm Dr. Joe Tatta. It's been a pleasure, and we'll see you next week.
Thank you for listening to the Healing Pain Podcast with Dr. Joe Tatta. To subscribe to the podcast and learn more, visit integrativepainscienceinstitute.com. That's Integrative Pain Science Institute.com. Sign up to receive weekly updates, leave a review on iTunes, and share this episode with your friends.